If you've been diagnosed with any kind of heart disease, vascular disease, coronary artery disease, hypertension, you may have been given prescription medications to control the symptoms. You may have been given aspirin to reduce the plaque. But you know that there are underlying imbalances that have crept up over time that have led to those conditions. When we try to look at these underlying imbalances, we have a chance at a cure. Those underlying imbalances lie in 5 areas. In the hormone area, the hormones that critically are related to your cardiovascular state. If you're a male, testosterone. We know now that even though the testosterone level of 250 to 1100 is normal, that men who keep a testosterone level in the upper range have a 40% reduction in cardiovascular mortality, because testosterone is critically important for the function of the lining of the blood vessels. The other hormone that's critical is estrogen. Estrogen in women controls the blood vessels in women. We know that women start to lose that protection when they go through menopause and when the estrogen levels decline. So hormonal levels being in an optimal range are part of the correction of your heart disease. The second hormone, the second area that we need to look at is nutrition. Many studies, over 8,000 studies done on omega-3 fatty acids, which come from fish oils, have shown their benefit in reducing cardiac disease. We also know that in the nutrient area, calcium and magnesium are very important for the functioning of that endothelial lining. Under nutrition, we know that animal-based proteins increase cardiac disease. Plant-based proteins decrease cardiac disease. The largest study right now in the world, that was the China study, showed that nitric oxide production and atherosclerosis improve when you are on more plants as far as your food supply. Toxicity-wise, we're aware that heavy metals bind to calcium and magnesium and cause more atherosclerosis. This is why many programs that are aimed at reducing heart disease and reducing atherosclerosis look for heavy metals and try to remove them. The mind, subconscious and conscious state of mind. This is not new information. We know that when we are able to meditate, when we are able to control the stressors that cause high-level beta waves in our brain, we're able to reduce the stress and the blood pressure that is being experienced by our blood vessels. The 5th area is going to be the state of the body itself, the state of the lymphatics, the state of the systems that are responsible for bringing the hormones and nutrition to the organs. So, for example, we know that every time the heart beats, every time the vascular system works, we're using specific nutrients like CoQ10 and L-carnitine and ribose. These all have to be brought to the final destination. Anytime you're looking to reverse cardiac disease, you have to pay attention to all 5 areas and usually start with the one that's priority in your individual situation.